Gjithë tani të ndjekim drejt për drejt një konferencë për shtyp të presidentit Amerikan Donald Trump.
There's never been a president even close that's been able to do what I've done in slashing all of the red tape and everything to get very important things to the market, medical. So we slashed red tape to develop vaccines and therapies as fast as it can possibly be done.
Për nevojën që duhet ketë sistemi Amerikan për të valluar koronavirusin për hapjen e tetë
We began the first
COVID-19.
clinical trial of a vaccine candidate for the virus, and that was launched in record time. It was just a few weeks.
Kemi bërë disa testime për të gjetur edhe vaksinën
Not so long ago.
që duhet për të
As we
luftuar
race to
koronavirusin.
develop a vaccine, we're also pursuing antiviral therapies, and that's what really we're going to be talking to you about today. That's the purpose of being up here today. And to me, that's even more important. The vaccine, by its nature, you have to have long tests because you have to make sure
Edhe nëse po përpiqemi për gjetur vaksinën, po mundohemi që të kryejmë edhe terapi virale për të frenuar përhapjen më tej të koronavirusit tek të infektuarit.
Great with the vaccines, but it's still a long process. But the therapies are something we can move on much faster potentially. And the treatments that will be able to reduce the severity or
Terapi do të
duration
jenë më
of the
të
symptoms, make
shpejta,
people
por
better.
për sa i përket
Essentially, we're looking
gjetjes së
at
vaksinës së
things to
dur, na pret
make
një kohë
people
gjatë
better.
përpara.
Or at the very earliest stages, they wouldn't even know they had it. And that's where I believe it's going to work even the best. The FDA Commissioner, Stephen Hahn, who's with us, he's fantastic. And he has been working 24 hours a day. He's been, he's worked like probably as
Të
hard or
gjithë
harder
janë
than anybody
duke
in
punuar
the group, other
24
than
orë
maybe
në
Mike
ditë.
Pence or me. And what the FDA is doing is incredible. They've done things in times that were not even thinkable.
Pra po bëjnë gjëra
And
të
I've
cilat
directed the FDA
do
to
të mund t'i
eliminate
mendonin
outdated
kurrë.
rules and bureaucracy, so this work can proceed rapidly, quickly, and
Që puna të vazhdojë të bëhet sa më shpejt.
we have to remove every barrier. There were a lot of
Duhet
barriers
heqim
that
çdo
were
ndalesë, çdo pengesë
unnecessary.
që të jetë
And
nevojshme.
they've done that to get the rapid deployment of safe, effective treatments. And we think we have some good answers. We'll find out very, very soon.
Dhe do të gjejmë
Clinical
disa
trials
përgjigje,
are
do të gjejmë
already
përgjigjet e
underway
dura
for
shumë
many new
shpejt.
therapies, and we're working on scaling these to allow many more Americans to access different drugs that have shown really good promise. We've had some really good promise. We will do so in a way that lets us continue to collect good data, to know which
Pra do të
medicines are
vazhdojmë të
safe
mbledhim të dhëna
and which medicines are working the best.
në
We
mënyrë
have a couple that were
ilaçet të bëjnë më
in
të
really
mirën
good
e tyre,
shape
të
on.
punojnë që të japin efektin e tyre.
and that's for immediate delivery. Immediate, like
Dhe këtë që duhet ta bëjmë sa më
as fast
shpejt,
as we can get it.
sa më
The
shpejt që të
FDA
jetë
has
mundur.
also approved compassionate use for a significant number of patients. You know what that means? We're also reviewing drugs that are approved abroad or drugs approved here for other uses. And you know, one of the things that I'm most proud of
Pra,
that I
po
got
mundohemi
was
që të
right
gjejmë
to try.
ilaçe të
That's where
cilat
somebody
sigurisht
who's
janë të
ill,
miratuara
somebody
jashtë
who's
apo
very
edhe
sick,
këtu tek ne.
terminally ill usually. In past administrations, we signed this a year and a half ago. You wouldn't be able to even think about getting any of the drugs that may be showing great promise now.
Pak nuk
And
do
they've
të
been trying for
jetë
many
e thjeshtë
decades
të
to get
gjejmë
this
ilaçin e
approved. And it
dur
sounds
që
simple,
do
but
të na
it's not because
premtojë.
there's liability involved and lots of other things. And I was able to get it approved working with Congress, right to try. This is beyond right to try. What we're talking about today is beyond right to try. Right to try
Po
has been,
punojmë
by
me
the way,
Kongresin dhe
tremendous
deri tani
success.
kemi
People are
hequr
living now that had no chance of
të
living.
heqim të gjitha barrierat.
Where we take treatments that would, things that would have to go through years of a process. And if somebody was terminally
Ky
ill,
është një proces që do të
and
marrë
I would say,
kohë.
why wouldn't they be able to try this? They'd go to Asia, they'd go to Europe, they'd go all over the world to try and find something. Or some people, if they had no money, would go home to die. They'd go home to die. They had no hope. Right to try has been an incredible success.
Pra, duhet
But this is
provojmë, duhet
beyond
të
right to try.
tentojmë që të kemi
If treatments
sukses.
known to be safe in Europe, Japan, or other nations are effective against the virus, we'll use that information to protect the health and safety of American people.
Ne do të përdorim
Nothing
çdo
will stand in our
informacion
way
për
as we pursue any
të
avenue
për
to
të
find
ruajtur
what best works
shëndetin
against
amerikanëve.
this horrible virus. Now,
Edhe kjo kur vjen nga vendet të
a
tjera të
drug
botës.
called chloroquine, and some people would add to it hydroxychloroquine. So chloroquine or hydroxychloroquine. Now, this is a common malaria drug. It's also a drug used for strong arthritis. Somebody has pretty serious arthritis. Also uses this in a somewhat different form. But
Trump në këtë moment, presidenti
it is
amerikan është
known as a
duke
malaria
përmendur
drug, and
disa
it's been around for a long
ilaçe.
time, and it's very powerful. But the nice part is it's been around for a long time.
Duke
So
treguar
we know
kështu
that
edhe evoluimin
if
e
things don't go
procesit.
as planned, it's not going to kill anybody. When you go with a brand new drug, you don't know that that's going to happen. You have to see and you have
Pra,
to go
një
long
ilaç,
tests. But this has been
një
used
ky
in
proces
different
ka
forms, very
pasiguritë e veta,
powerful drug
sepse
in
në
different
qoftë
forms.
zbulohet një ilaç
And
që
it's
ne nuk e
shown
dimë se
very
çfarë do të
encouraging,
sjellë.
very, very encouraging early results.
Ka të dhëna inkurajuese,
And we're going to be able to make that drug available
por ne do mundohemi që
almost
këto ilaçe
immediately.
t'i bëjmë
And
sa më
that's
të
where the FDA has been
domosdoshme,
so great.
të nevojshme.
They've gone through the approval process. It's been approved. And they did it. They
Sapo të
took it
kalojmë
down from
procesin e
many
miratimit.
months to immediate. So we're going to be able to make that drug available
Pra do mundohemi
by
që ta
prescription or
që
states. I
këtë
spoke with Governor
ilaç,
Cuomo about it at great length last night.
ta
And
jeti
he wants to be right on.
I përdorshëm
he wants
edhe
to be
me
first on line.
recetë.
And so I think that's there's tremendous promise.
Është një premtim
based on the results
inkurajues, është një
and other
premtim i madh
tests.
në
There's
fakt,
tremendous promise. And normally the FDA would take a long time to
por që
approve
ka një
something like
progres të
that. And
konsiderueshëm
it was approved
dhe
very, very
organet
quickly, and it's
përkatëse po e
now
ndjekim me
approved
shumë vëmendje.
by prescription. Individual states will handle it. They can handle it. Doctors will handle it. And
Edhe shtetet
I think it's
individuale
gonna
do
be-
ta ndjekin në
I think
mënyrën e
it's gonna
tyre.
be great. Then we're quickly studying this drug, and while we're continuing to study it,
Mendoj se
but
do
the
të jetë
studying
diçka e
is going to
madhe,
be also done
do të
as
studiohet,
it's given out to large groups of people, perhaps in New York and other places.
do të studiohet
Study
nga
it
një
there.
grup i
There are
madh njerëzish
promising
në New York
therapies
apo edhe në
produced
vende të
by
tjera.
Gilead, and that's remdesivir, and that's a drug used for other purposes that's been out and it's had very good results for other purposes, but it seems to have a very good result having to do with this virus. And that drug also has been
Trump po përmend një tjetër ilaç që
approved or
me sa
very
duket ka
close to
dhënë
approved in
efekte
that case
sëmundje të
by
tjera, por
the
me sa
FDA.
duket mund të
And I can't
përdoret,
tell you how much we
mund të
appreciate what
studiohet
the
edhe në
FDA, these
rastin
people are
e
incredible
këtij virusi.
patriots, and the job that Stephen Hahn is doing, Dr. Hahn, who's one of the most respected doctors in the country, by the way, where we took him.
Presidenti
I
në
said,
moment
"You
është
sure you
duke
want to do
vlerësuar
this?"
dhe të gjithë
Now, we didn't know
ekspertët
that this was going to
të
be
cilët janë të angazhuar
in the playlist what
në
happened here,
luftën
but
dhe
he
struktura
really has stepped
qeveritare
up
në
to the
luftën
plate.
ndaj
Oh,
përhapjes
you
së
are
koronavirusit.
You really have. I shake his hand, but I'm not supposed to do that. Get in a lot of trouble if I did that. But he's been fantastic, and I thank you, Doctor. He's going to speak right after I'm finished. So, Regeneron again, is a company that's done fantastically well, as I understand, with Ebola and some other things. Great company.